this video I'll talk about CCCA, or Central Centrifugal Cicatricial Alopecia. Now I know that's a mouthful of words, but we'll break it down, we'll get right to it. So CCCA is a condition that is a hair loss type that affects the vertex or the central scalp of women of African descent, and we suspect actually quite a few men, only those are sometimes and possibly overlooked because they're suspected to have another type of hair loss, which is called androgenetic alopecia, or male pattern hair loss, which can sometimes look like CCCA. CCCA is not AGA, or androgenetic alopecia. It is in fact a type of scarring hair loss which can create permanent and irreversible changes on the scalp, leading to permanent hair loss over those areas. The condition is named the way it does because it appears on the center of the scalp. It is centrifugal, meaning that it is extending peripherally from the origin or the center of the scalp where it first appears, peripherally, or extends sideways to the surrounding areas of the scalp. And it's cicatricial, meaning it's scarring. Alopecia just means hair loss. Any hair loss of any kind falls under the category of alopecia. So central centrifugal cicatricial alopecia means hair loss that appears on the center, extending sideways, and is scarring, and that is the case with CCCA. Now CCCA can affect people at any age, really, starting from the late 20s up to the mid 50s and 60s. We mostly see patients who are afflicted or suffering from this condition in their 50s and 60s after they've waited a while to see a dermatologist for their hair loss. Now, why does it take a while for someone to see a dermatologist for something so devastating? Well, I have a few guesses as for why that happens. A lot of people coming into the clinic just think it's part of normal life. It's just part of getting old, and they haven't really thought that this is something that needs attention. And all of a sudden somebody points that out to them and they end up in the dermatologist's office. I think that in some cases, people who come in with CCCA have a long track record of hair grooming practices, and those hair grooming practices can be masking the hair loss that can be developing insidiously or sneakily under the hair grooming practices of sorts, under the weaves, the braids, the cornrows, and all sorts of other hair practices that are common in the African American community. Now, as far as what CCCA does, so it does appear, starting progressively appearing in the 20s, 30s, probably becoming most noticeable in the 50s and the 60s. Now, this condition is devastating. Now, this condition obviously has a genetic tendency attached to it. Obviously, it's more common in women and men of African descent. And it has been shown that there are some genetic mutations that make people more prone to developing the condition. As far as symptoms that are associated with CCCA, some people experience no symptoms at all. In fact, a vast majority of the patients do not really notice anything going on. They just wake up one day and notice that they have hair loss. But there are many cases that show up with an itch or a burn over the scalp, or a sensation of tightness over the areas of hair loss and beyond that. And CCCA, we don't really know beyond the genetics what is causing CCCA, but there have been some guesses that many hair grooming practices could be contributing to CCCA. Specifically, there was a sense that tension or the tight braiding of hair could be causing that. Also, there was a sense that practices like relaxing and perming the hair could be causing or contributing to CCCA as well. I think at the end of it, when we really boil it down to the common denominator, the practices that may have been associated or may be associated with CCCA are all associated with persistent irritation of the scalp. CCCA does have an inflammatory component to it, meaning there is some irritation of the hair follicle, which is associated with the hair loss. Now, is that the chicken or is that the egg? We don't know. But there's clearly an associated irritation of the scalp that comes along with CCCA. So obviously anything that can create irritation over the scalp, whether it's tension irritation or chemical or physical abrasion irritation, can contribute, at least, maybe not specifically, but can contribute to the development of a condition that's already going on. Whether it kickstarts it or not is a different question. I don't know that we can really answer that. However, let's take a look at what can be done about, first of all, scalp irritation. How should we approach that? And second, what to do when you find out you have hair loss. So as far as practices of hairstyling, I don't think we can categorically say that you cannot use those practices as a matter of principle. I think we really need to break it down and know which practices are clearly harmful to you and which practices can be actually changed or modified to not be as irritating to the scalp. So I would eliminate or tone down any practice that is causing irritation of the scalp, meaning itch or pain or burning or tightness, or is associated with the skin turning purplish or reddish or flaky over the area. Those practices, whether it's braiding, tight braiding of the hair, or extensions or perming of the hair, I would try and tone the practice down to tie the braids a little bit more loosely if that's what you're doing, or if it's something else like perming, I would go for obviously no-lie relaxers. So I would obviously go for no-lie relaxers, meaning something more gentle on the scalp skin, and also try and tone it down, meaning try and use the practice as infrequently as possible, as little as possible, to the best of your ability, obviously. Now, if you've noticed that you are experiencing a tightness or an itch or a burning or changing in color of the scalp and flakiness, those are clear signs of irritation. If they're persistent, then you have a problem. You may not be experiencing hair loss yet, but you could very well be going into hair loss stage at some point. So it's important to back away from practices to the best of your ability that you think are irritating your scalp, especially if irritation appears right away, right after you've done whatever it is that you're doing to groom the hair. Back away from those practices, and if that has not helped the persistent sensation or appearance of irritation on the scalp, be sure to see your dermatologist to evaluate your condition. Also, ask your hairstylist or barber to pay attention to what's going on the scalp. Now, hairstylists and barbers, hair care professionals in generally, are trained to notice things that are out of the ordinary on the scalp. They're trained to notice lesions, they're trained to notice sores, they're trained to notice pimples on the scalp, they're trained to notice redness and flakiness on the scalp, and they're trained to notice hair loss. So they will point it out to you readily and happily. They'll point it out to you. I think something is going on here. Obviously, have family members also keep an eye on things, and that's something we all do. But if you're noticing, or your hairstylist or your hair care professional notices that there's something off with the scalp, that needs to be addressed by a dermatologist. Don't do it on your own. Don't try and apply some magic potion to the area, some homebrewed solution. These can backfire, because if you're guessing your way through treatment of hair loss, first of all, you may have CCCA, but you may have another type of hair loss that could be treated completely different. And that could completely derail first of all, the evaluation, the bottom line, and then the treatment and management, the duration of the management. Some hair loss types are reversible, some hair loss types are not, and we need to diagnose the type of hair loss that you're suffering from very specifically and care for it specifically. So as far as treatment of CCCA is concerned, CCCA is actually notoriously hard to treat, meaning it's hard to stop the condition from progressing, and it's hard to regrow the hair back onto the scalp. That being said, you show up early enough, your symptoms and your hair loss may be reversed to an extent, and if not reversed, they can at least be stopped. Even in severe cases, we can still stop the hair loss and treat the symptoms, but the treatment is more challenging in those conditions. So what types of treatment are available for CCCA? Well, CCCA doesn't have a great track record of research to back up treatment modes or treatment options, but we certainly have things in our arsenal that we use to treat patients with CCCA that work quite well in the clinic, specifically topical or injected steroids. In some cases, we use minoxidil to try and stop or induce hair growth. It doesn't work very well in most cases, but in some cases, believe it or not, it can actually help. And then hair transplantation is sort of the end-all be-all or the last resort treatment, but it can definitely make a difference by transferring hair follicles from another part of the scalp that's not affected with your hair loss to the part that is afflicted with hair loss. So that can make an immediate difference for you in the way things appear. Recently, there have been a few publications of case reports of a technique called PRP, or platelet-rich plasma, a technique that involves drawing the patient's own blood and separating the blood in a centrifuge from the red blood cells from the plasma and the platelets, then injecting the platelet and plasma concentrate into the scalp. That is a treatment option that is used in many cases of male pattern or female pattern hair loss with great rates of success. CCCA has still got some ways to go as far as establishing it as a credible technique, but the case reports that have been out there and in my own experience, we have seen some promising results in that regard. So there is hope as far as new modalities and new treatment techniques emerging to treat CCCA. There's also been some clinical trials recently that are coming to a close, so it's important to keep up with the current research and see what is up the pipeline for the very near future. Thank you so much for watching this video. I hope you got some great value out of it. If you did, please hit the like and subscribe button to support the work of this channel. More great content coming your way right from this channel. Thanks so much for watching, and God bless.
Brian Little.